if not everybody. So I think we will make a start. Do we want to get the recording going? Fantastic. Great, thank you, Nathan. That's the recording starting, so I will get us started. Good morning, everybody. Welcome to this public board meeting of NHS Highland. It's lovely to see you all. Welcome, of course, to all our board members and any members of the public and the press who are with us today observing. So just a bit of housekeeping before we get going. So as I mentioned, the meeting is being recorded so that we can upload it onto our website later on. I'd just like to remind everybody if we can use the show hands function if you want to ask a question or make a contribution. We don't use the chat function in this meeting, and if you can keep yourself on mute when you're not speaking just to reduce any background noise. So a few welcomes and introductions and things like that this morning. So before we kick off, I'd like to welcome Dr. Heather Bain, who's with us from the University of Highlands and Islands. So Heather's here on behalf of Brian Williams, who's obviously been to our board meeting in the past. So a big welcome to Heather. And also a few movings on and comings in. So firstly, I'd just like to take the opportunity at today's meeting to pay tribute to our current Area Clinical Forum Chair, Katrina Sinclair. So Katrina's term will be coming to an end soon this year, and it just felt like a good opportunity to pay tribute to the work that Katrina's done with us. So we all know Katrina. Katrina's brought her extensive experience to that role, chairing the Area Clinical Forum, and indeed her role on the board as that representative. Katrina's been dedicated, enthusiastic, active, and has really contributed to our business. I think it's fair to say that under Katrina's chair of the Area Clinical Forum, we've seen a real change. She's really helped us drive forward in how we engage with the board and the Area Clinical Forum, how we work together, and use that space to support the varied advice of our clinicians and our professional advisory committees. And that work will continue. I'm sure we will find out in due course who the new chair of the Area Clinical Forum will be, and we'll share that with you once we have that information. But we know that that legacy that Katrina's put in place will continue, and I've really valued Katrina's support. And Katrina, I want to wish you all the very best for your future. I know you're not disappearing. You'll still be doing your day job, your other jobs. So we'll wish you all the very best, and thank you for all of your contributions at board. Another thank you. So today you'll be seeing a lot more of Nathan fulfilling the role that Ruth Daly, who was our previous board secretary, used to fill in these meetings. So of course we know Nathan. Nathan is our governance and corporate records manager. I'd just like to say thank you to Nathan for holding everything steady and maintaining that continuity for us after the departure of Ruth. We know that you've worked really hard to keep the show on the road for us, Nathan, and that's been really, really helpful. Nathan's going to hold everything steady until our new head of corporate governance, Dominic Watson, joins us next month as well. So thank you to Nathan. And a couple of other welcomes. So I'd like to welcome our newest board member, Dr. Neil Wright, who started last month. So Neil will be known to you because of his previous role on the Highland Health and Social Care Committee as a GP representative. But Neil, of course, brings a wide range of experience to the role. Hopefully you've all had a chance to have a kind of a one-on-one introduction with Neil, but if not, we'll be able to set those up in the coming weeks. And a welcome also to Liz Humphreys. So Liz is the non-executive director and whistleblower champion for Scottish Ambulance Service and for Public Health Scotland. So Liz is here observing today as part of the Aspiring Chairs programme as well. Okay, let's kick off with the business. So first of all, Nathan, do we have any apologies?
Thanks, Sarah. We've apologies from Brian Williams, and Dr. Heather Bain will be joining in his place, and also from Pamela Stott with Rhiannon Goydell attending on behalf of her too.
That's great. Thank you, Nathan. And just to advise, not an apology as such, but I know that Fiona, you need to leave at a certain point in the meeting. So Nathan, for the minutes, we'll just keep an eye on that when Fiona needs to step out. Lovely. Okay, do we have any declarations of interest, please? Morning, can I have Alistair first and then Steve?
Yes, good morning, everyone. I had considered making a declaration of interest in my capacity as a Highland councillor, but having analysed my connection to the items on the agenda and applying the objective test, I feel I don't need to do so. Thank you.
Thank you, Alistair. And Steve?
Thanks, Chair. Morning, everybody. I also considered making a declaration as an employee of High Life Highland, but haven't applied the objective test. I don't think it's required. Thank you.
Okay, that's great. Thank you, Steve. I'm not seeing any other hands up, so we can move on. So next we have the minutes of our previous meeting on the 25th of March and the action plan. So these are in front of us for approval of the minutes and noting the action plan. So we'll take the minutes first of all. Does anybody have any matters of accuracy to raise? Okay, I'm not seeing any hands up. So are we content to approve those as an accurate record? Great. Okay, we also have the action plan, which I thought I had open, but I don't. So I'm just going to open that now. So we've got a number of actions listed on the plan. As you can see, we've got a few that are proposed for closure today. I wasn't going to suggest that we go through the items kind of or the actions one by one, but I am happy to take any questions or comments. I've got a couple that I'm potentially going to say we don't close, but I'll pause. Does anybody have any questions or comments about the actions before I come in? No, okay. I actually wondered if there's a couple that are proposed for close. I think I would prefer to keep on here if we can. And there's a couple of actions where we are going to, or we're proposing to take through the new Population Health Committee, which, skipping ahead in the agenda a little bit, is an item that we have for approval later on. I actually think I'd prefer to keep those open just now, because until that committee is approved, we don't have a work plan for that committee to put it on. And I'm possibly being a little bit over the top here, but I'm just slightly worried that in between closing this and establishing our new committee, it might slip through the gaps. So Nathan, if that's okay, the ones where we're saying they'll go through Population Health Committee, if we could just keep those open for now, and then once we've transferred them into the new committee, once that's set up, then we can close them off. Is that okay?
Yeah, that's fine. I'll do that. No problem.
Great. Is everyone okay with that? So I'm possibly being a little bit over the top, but you know, it's a fast-paced world. Things get lost. Good. I don't have any other comments or questions. Are people happy with the others being closed? I think all the others were sort of information that had been circulated round. Jerry.
Sarah, I just wanted to pause on. Sorry, I can't remember the action number. It's the one in relation to the corporate parenting and the health assessments. And I have to say, I'm not 100% convinced that the correct governance route is through the JMC for a matter that's raised at the board.
Okay, yep, I can see the one that you mean. So I had it and then I lost it again. So that is action number 36, I think. So
I'm not saying it's wrong. I think it just warrants a little bit of a pause.
I don't know, Tim, I can't see, sorry, if Tim's with us. I don't know, Tim, if you want to come in on that. Do we want to take that away and give that some further thought?
That would be fine. I'd be absolutely fine with that, Sarah.
Yeah. I think we need to. Yeah, I'd agree. I think we need to get the action right. I think it's a bit. I don't think we can sort it out immediately. So I think we just need to take that away.
Okay, that's fine. So we'll keep that one open as well, Nathan, and we'll take that offline to firm up that action a bit better. That'll be fine. Okay, and then the remainder we can close. Okay, excellent. Right, thank you very much. And then I'll just pause before we move on. Any matters arising that people wish to raise? Okay, great. In that case, I shall hand over to Fiona to speak to her Chief Executive's report.
Thank you, Sarah, and good morning to all board members and everyone else who's joined our board meeting this morning. As Sarah's already indicated, I'm having a more unusual board day than usual, so I join you from NHS Lothian headquarters in Edinburgh, and that's because all board chief executives have been asked to meet with the First Minister this afternoon to discuss our progress in regard of the operational improvement plan, so hence my need to apologise for my absence later in the meeting. I think if you've got an excuse, that's not a bad one. So David Park will be here throughout the meeting, so I'll be leaving you in good hands. So on to my report and on to my first item. So since our last board meeting, Neil Gray, Cabinet Secretary for Health and Social Care, visited the board in April. On this occasion, Mr Gray had a tour of the National Treatment Centre with the local leadership team. As well as seeing the high quality healthcare environment, Mr Gray was briefed on plans for increasing the utilisation and capacity of the unit through additional funding that's been provided. Mr Gray also spent time with the clinical and leadership staff in the emergency department at Regmore Hospital, hearing about recent improvement, tests of change, particularly that of utilising allied health professionals differently within the emergency department, which is providing early indications of improving access and flow through the department. Since our last board meeting, we have, however, received the outcome of a care inspectorate inspection of care at home services in Sutherland, that outcome being an improvement notice. Whilst an action plan had already commenced, this was considerably strengthened and a large-scale investigation commenced. I'd like to take this opportunity to apologise to any service users in that care at home service whose care was not as it should have been. Our social work staff have been in touch with service users and their families to provide support and guidance, and considerable work and support has been undertaken to improve the local situation and to ensure that quality assurance of social care in other areas of the board is improved. You'll also note the update in my report on progress with discussions in Highland on the integration arrangements between NHS Highland and Highland Council. I also wanted to provide board with a further update in regard of the work being undertaken by myself alongside my medical and operational leadership in regard of vascular services. Through close working in particular with regional colleagues and senior leaders in large vascular centres across Scotland, we are sustaining mutual aid arrangements while pushing hard to develop a settled model in line with the recommendations of the Vascular Society. I'm grateful to my Chief Executive colleagues across Scotland and their teams who are supporting Highland in our work alongside the work with Scottish Government to move forward with planning for meeting those standards in the future. So on to some areas of good news. HEPMA, the hospital electronic prescribing, is now rolled out almost everywhere in Regmore Hospital, and this follows on from the rollout across many other sites that I've listed in my report. The feedback from clinical staff has been significant, giving a real boost to the working experience and the confidence of increasing our patient safety work. And also in my report, I've noted that we have 2 local pharmacies that are being recognised for national awards. Lochardle Pharmacy winning the Community Pharmacy of the Year, and Kinwell Pharmacy in Nairn winning the Innovation in Community Pharmacy Practice. Fantastic work, and congratulations to both of the teams. So I'll pause there, Chair, and I'm happy to take any questions on the content of my report. Thank you.
Thanks, Fiona, and yeah, huge congratulations to those 2 pharmacy teams. That's great to hear, and fantastic news around HEPMA. I know that we've been waiting with bated breath for that, and that's really welcome to see that progress. And in terms of that feedback, really good to hear the positive feedback. I suppose we could be a little bit naturally averse to new things coming in and worry that actually people will resist it or not feel comfortable using it. So it's great to hear that people are happy and welcoming that. I think that's going to be great, and it's going to once that's rolled out everywhere, that would be fantastic. Okay, any questions or comments for Fiona on her report? Emily.
Thank you, and thanks, Fiona. I just question on Sutherland Care at Home. I appreciate the focus will have been on the immediate remedial actions required by the report, but has there been any progress on understanding sort of the communication and governance issues that led to people finding out perhaps not in the desired order? That would be great to know if there's been any understanding of that. Thank you.
Thanks, Emily. I'm going to pass that question on, if you don't mind, to David Park, because David's been working more closely with the broader situation in Sutherland. So I'll look to him to provide you with a wee response there. Thanks.
Yeah, thanks, Emily. That really will be the subject of the large-scale investigation, to be able to go through that. So yes, we have seen early indicators, and indeed that's been what we've used to respond, which is around coordination and training in particular. But there's going to be wider learnings from the review, and as I say, that formally that will come through the large-scale investigation and an action plan developed from there.
Thank you.
And can I just as a follow-on to this, it's not, I suppose I'm asking as a result of what's happened in Sutherland, but I suppose more broadly, I wondered if I could ask a question about how we support our staff through that as well, because, you know, I can only imagine how difficult it is. We know that our staff are, they're working as hard as they can to deliver these services. And I suppose it's recognizing how difficult that will be to work in that service, in that community, and to have that improvement notice. And I suppose also have the attention of the local community for not great reasons. And obviously, as we know, we have challenges recruiting and retaining workforce in areas like that. And I just wonder how do we support staff, and how do we make sure that they can come through it on the other side feeling good about the work that they do, and I suppose in turn try and continue to make NHS Highland an attractive place to work.
I'll come back in if that's okay.
Yeah, thanks.
Sarah, you've identified a really important element in the review process. It's not just a technical review in what we're doing, but it's very much, it is a people delivered service. And so therefore, the greatest asset we have is the people who are directly involved in that. I suppose one of the reflections it does make is that effective care is not just dependent on effort, but also technique. And so we're looking at both aspects of these things, recognising it's a combination of both organisation as well as frontline delivery. And that's one of the reflections that was made, and the corrections in place to try and improve, in particularly the allocation process and the organisation of daily work that makes a difference. So recruitment and retention also is very important to us in that area, and I know we've had recruitment challenges there. We did have a recruitment fair that ran last week, and that was a successful event, and we've seen the success of that, running that on the West Coast as well. So it may well be these are things that we take forward in other areas when it comes to recruitment, because that galvanising of people and community is really important to us.
And Chair, if I could just add to David's response, if that's okay. So whilst not directly as a result of this particular inspection outcome, but last week NHS Highland held a leadership and management virtual conference, because really what you're talking about is a leadership function of prioritising our staff well-being in contexts where things are going well, but also in contexts where improvement is needed or challenge has been experienced. And there's probably others on the call that were closer to the event. I was fortunate enough to open the event, but we had over 500 bookings on the event, which was unbelievably successful in terms of attendance. So that support we're providing in terms of training and helping people to learn those leadership skills, that's all part of that package as well, which I'm sure that there will be people from right across the board area that will have benefited from that fantastic event last week.
Thanks, Fiona. Yeah, I went to the event as well, and it was a brilliant event, and I couldn't believe how many people were there. And it was a great day, and I couldn't join for the whole thing, but I dipped in and out, and they had some fantastic speakers, and it was a really energizing event. Actually, it was really good. Okay, sorry, I've got some other people waiting to come in, so I've got Muriel next, please.
Thank you. I think Fiona's answer there has sort of preempted my question. It was the review is obviously, and the learning from the review is really important, and how we roll that out to our other care facilities in order to support staff and service users as well. But it's really refreshing to hear there were over 500 people that had registered for that. So it obviously, in my opinion, highlights the need, and I would hope that there's possibly a follow-up for that. But basically my question is how we continue to support our other areas and facilities and staff, and make sure that they've got that voice that's heard in there. Thank you.
Thank you. Thanks for that question, Muriel. So I think there's probably two ways that I would think about that question. One is, the most important support that we know that our staff experiences in their line management arrangement and the person who they have a meaningful supervisory relationship with. So having staff that feel skilled, competent and optimistic in those line management and supervisory roles is absolutely critical to the culture of the organisation. So last week's event was fantastic, but Gareth's obviously got a whole programme of work with the people and culture team alongside our leaders and managers for the year ahead, in how we continue to equip people to have those skills. But I think you're also asking about how people can make sure that risks, and good news, can also be highlighted through the organisation. So we continuously work on our governance arrangements, our clinical and care governance arrangements, and that committee continues to do its self-assessment and improvement work, because that's the route with which people have an opportunity to escalate where they feel that they can't manage a concern or a risk within their own area. So I think it's probably the combination of both of those things, but those are always subject to a continuous improvement endeavour.
Thanks, Fiona. And Alex, please.
Morning, folks. Thanks, Chair. Just a confirmation about the additional funding that the NTC got. Is that a one-off funding, or is that going to be every year for the next several years?
So, I'm wondering, that question may require a crystal ball that SG didn't provide me when I took on the role, Alex. So I think we don't know. So some of the activity obviously that's undertaken is part of our core funding, and some of it is additional. This particular tranche of funding is additional. But I'll let Heleth come in on the technicalities if she wants to. No pressure, Heleth. But we know when programmes have been very successful in the past, that then government have sometimes made funding that was originally short term into longer term. But I think it would be probably too early to predict that, but we could be aspirational that if we're able to demonstrate that the National Treatment Centre can operate at this additional capacity, that would be something that would be of long-term benefit to the people of Scotland. But obviously, I'm biased, so but I'll let Heleth come in as well.
Thank you, Fiona. I was going to come in, so that's fine. The planned care additional money for NTC has actually been confirmed as being recurrent. It's the only element of the planned care funding that has been confirmed as recurrent, but it does come with a caveat of as long as we deliver our activity. So there is some nuance in there around being able to evidence that performance, make sure that we continue to receive that. How they would then withdraw it or change that, I'm not sure. But Catherine and the team are in regular contact with the Scottish Government team, so we would have, I think, an early indication if things were changing and likely to change. But technically, it's been confirmed as recurrent funding.
That's great. Thank you. Okay, I'm not seeing any other hands up or questions. I suppose just one comment I wanted to make. I'd written it down in my notes. It's brilliant that Cabinet Secretary came up and got to see, you know, almost those two different settings, the National Treatment Centre and our emergency department, which, you know, two very different kinds of work. And I think that's really fantastic that he's been able to see that. But I just suppose it made me pause for thought a little bit and thinking about how actually it's quite attractive for our elected members or other people who are interested to visit our sites, our buildings. But actually there's some, you know, phenomenal work happening out in our communities. And some of my most enjoyable visits that I've done have been out to community teams to see how they're working in the communities. And I kind of, it'd be really exciting if we have the opportunity to influence where Cabinet Secretary visits in the future. It would be quite nice to be able to you know, suggest that you might want to see what some of our community teams are doing as well, because obviously as part of the whole system, that's hugely important. And yeah, what they do without a building is amazing. Okay, good. Right, I'm going to move us on a little bit. So thank you, Fiona, for your report, and we can note that. So we are now on to our reports from our various committees. So we have approved minutes in front of us, and we have some short summaries from the more recent meetings. So chairs, I'll just ask you to pull out the top points. We don't need to go over all of the detail of the reports, but I'll let you pull out any particular points you want us to be aware of or discuss. So first up, we have Alex. So from the Finance, Resource and Performance Committee, we've got the agreed minutes from the 14th of March and the 4th of April. And obviously there was a meeting on the 9th of May as well. So Alex, any key points you want to highlight?
Yeah, just a few we have. Positions, finance positions 10, 11 and 12. We were discussing them in some detail, and Helen will no doubt go into them later on. We also discussed the letter from the Scottish Government relating to the 3-year financial plan. Again, that's been picked up in the agenda item section and go into detail there. Environment and sustainability, a lot of good stuff there coming through on the quarterly report. Considerable progress on reducing the carbon emissions, particularly throughout the estate and the heating side of things. We do have a Scottish Government 75% reduction in heat decarbonisation target for 2030. That's, I'll say, very challenging, to be polite about it. It's going to be very difficult, and the amount of money that's required to bring that to fruition is going to be quite large. IPQR, again, a lot of discussions there, long waits, etc., and work underway to address some of the issues that are there. Digital healthcare strategy update was very good, and the risk stuff we did. The financial risks, basically we're growing them up now. They're done for this year, but we're now looking to see the wording that we require to continue with those risks in the next financial year. And that's the update. Any questions?
That's great. Thank you, Alex. That's a really helpful summary. Any questions for Alex around the work of that committee? No, okay, that's great. Thank you, Alex. Next up, we have the Staff Governance Committee. So I'll ask Steve to speak to this now. It's a little bit unfair on Steve because we've got the agreed minutes of the 4th of March, which Steve did not chair. That was Anne when Anne was still with us. But then we've had the more recent meeting of the 6th of May. Obviously, we've got the minutes and the summary in front of us. But Steve, are there any highlights you want to draw out for us?
Yeah, thanks, Chair, and thanks to the committee for appointing me as Vice Chair and then putting me in the chair seat. So despite the chairing, I think, yeah, we had a really good meeting, discussed the draft ADP and gave that substantial assurance. The committee particularly liked the deliverables that were associated with staff governance in that document. So I think well done there to the team. I think we had an update spotlight session on employability and acute, and really good to see how the employability strategy is now being implemented operationally. So some good discussions around that in terms of this organisation, becoming that anchor organisation across the region. Good discussion there. I think the highlight of the committee was the 2 annual reports, and Fiona just talked about the training event that happened, but education, learning and organisational development. I think it was obvious to the committee that combining both of those departments is working ever so well across the organisation, and really delivering that sort of economy of scale. So some good discussions around both of those services. And we had the annual report from medical education. And I think that was an education to a lot of the committee members ourselves, just to see the scale of training that happens internally across the organisation, and how senior colleagues within NHS Highland give of their time to support those more junior colleagues to develop them. And we actually, after discussion, decided we'd move from moderate to substantial assurance on that particular report. So yeah, that's a précis of the committee, and happy to try to take any questions. Thanks, Chair.
That's great. Thank you, Steve. That sounds really good. And yeah, sorry, I should have mentioned, yeah, Steve was nominated as vice chair, and then we quickly tested that theory. Philip, you wanted to come in?
Yes, just on Steve stepping in where I should have been chairing. It was just a thanks very much at short notice for doing that, and a public acknowledgement for that. And I shall definitely chair the next one, Steve. Thank you.
Steve, go on.
Just in the theme of giving everybody thanks, I should thank Jerry for coming along and nominating me as vice chair, or we wouldn't have had a meeting at all. So thanks, Jerry.
Oh, look at this team spirit. This is great. This is, yeah, love it. Thank you. Well done, everybody. Good. Okay, any questions or comments around staff governance? I have to say, I'm really glad those spotlight sessions are still continuing. When I was in staff governance, I really enjoyed them, actually. I think they really help bring the strategic stuff to life when you can understand how it's happening on the ground. So that's really good to hear that. Okay, nobody for that one. So next up, we have the Highland Health and Social Care Committee. So we've got the agreed minutes of the 5th of March, and then there was a subsequent meeting on the 7th of May. So Jerry, I'll invite you to give us the top highlights.
Okay, I'll go through it quickly. I won't touch on anything that's going to come up later in the agenda. So we had our annual Care Home Collaborative annual report, which gave us good assurance on the care home sector across North Highland. I think it highlighted the ongoing fragility of the sector, principally driven by money, which is in there, and I think we take the opportunity always to record here the continuation of the national care home contract and the problems that causes us. And I know colleagues have raised that at senior levels, but I think it's important that we take the opportunity to note that. We did note that we've got, I think it's up to 78 new beds opening up in the sector over the course of this year, which I think is really positive news. Tim came along and gave us an update on where we are on the implementation of the vaccinations options appraisal. And quite rightly, so it's been basically split into 2 main streams, children and adults, and work continues apace on those. And we've asked for that to come back to the September committee when we should be a little bit more advanced there. The Director of Dental Services came along and gave us an update on the current situation in dental. And unfortunately, we're not able to report a significant improvement on our dental services. Many of the issues which the Director of Dental Services identified a few years ago still exist. I think we're using as many levers as we can, and I think we've awarded, I think it's 4 now, Scottish Dental Access Initiative grants, which we get to utilise because of the remote and rural nature of our services, to encourage services to develop across the piece. But it's still a very, very challenging position there. And just finally, just to say, we welcomed Neil Wright onto the committee in a different capacity. He'd been on the committee for a long time as a lead GP, but he's now on as a non-executive director. But we were also delighted to welcome Dr. Tom Brown, who's joined us as the lead GP onto the committee, because it was really important that we had that role fulfilled. So thank you very much, Sarah.
Thank you, Jerry. That's a really helpful summary. Any questions or comments for Jerry? No, okay, great, thank you. So next up, we've got the Clinical Governance Committee. So we've got the agreed minutes of the 6th of March, and then there was a summary of the meeting that took place on the 1st of May. And I'd like to invite Karen to speak to this, please.
Morning, everyone. Thank you, Sarah. And I'd also like to thank Fiona, because she's actually given a lot of my updates, so thank you for that. As unsurprisingly, there was a lot of discussion, an update around the vascular service and care at home services, and the issues in Sutherland. There was also, I think, a lot of time spent talking about the position of the NDAS service, and some challenges being experienced. And again, as I'm sure we all know, this is a national problem, and we have our share of that. So there was quite a lot of discussion around that. There was a number of papers, and there was a recognition that we needed to have some pulling together of that into an executive summary, which officers will be working on. There was, it's clear there's a lot of activity for everyone involved in those services to keep them, running as much as they can, but there are challenges for the people working in those services, and obviously the experience that affects onto people who need to use the services. Other than that, there was the usual mixture of papers, taken on Fiona's point and Muriel's observation around the recognition of risk from floor to board. That's obviously something that Clinical Governance Committee are very keen to see, and I've met with some of our teams over the last couple of weeks, just to get a sense of their views around that, and help to hear, for them to hear, how we want to continue to see that floor to board information flow coming through. So that's been really helpful to get a little bit more detail, particularly from the acute services that I met with earlier this week. So you have the minutes there, and you have the summary. Pleased to take any question, and obviously bring in our executive colleagues to answer them probably. Thank you.
That's great. Thank you, Karen. That's really helpful. Okay, any questions or comments for the Clinical Governance Committee? No? Okay, that's great. Thank you, Karen. Next up, we have the Audit Committee. So we have our agreed minutes of the 11th of March, and then a summary of the later meeting on the 13th of May. Emily, I'll invite you in, please.
Thanks, Sarah. So we having had a very, very packed March agenda, we were a little bit lighter in May with no new internal audit reports coming forward, but we did discuss children's services, for which the fieldwork has commenced, which is really good news. There has been some delays, which are a tad frustrating for internal audit, but the work is underway, and they're currently aiming for the September meeting, but we'll get an update in June as to whether they're still on track with that. So it is good news given the history that the fieldwork has started. We mainly focused on the management action plan in the absence of any new internal audit reports. We invited Ian Ross to come and present an update on cybersecurity because of the number and magnitude of issues that were identified there, and really pleased to report good progress on those. They're all currently on track for closure. So we have actually requested that adult social care and complex care come to the June meeting with an update, just because there was a couple of target dates missed on those, and we haven't got new target dates in place. Just to keep those actions within governance, we'll be requesting a more fulsome update in the June meeting. Other than that, we had the first of our risk management standing item spotlights, which Boyd kindly presented an overview of the system, and also a section on risk appetite, which I think the committee found really useful. I think that's all in terms of a short summary, but happy to take any questions. Thank you.
That's great. Thanks, Emily. That's really helpful. Any questions or comments for Audit Committee? Okay, and next we have the Argyll and Bute Integration Joint Board. As always, our timing is phenomenally out of sync with the IJB. So that's the minute of the meeting that took place on the 26th of March. But I'll just, if Graham wants to add any comments, then please do, Graham.
Yes, good morning, and thanks, Chair. We're racing through the agenda, so I'll try not to spoil that run. I'll just highlight a couple of things. You'll have noted, as Sarah said, that that was at the end of March, and a reminder that it is the Argyll and Bute Integrated Joint Board, closing the name. It's a jointly NHS and Argyll and Bute Council, and that means that a councillor chairs for 2 years, then a health board rep chairs for 2 years. So Councillor Dougie McFadden, that was his last meeting as chair, and he's done a great job, and hard to follow in his footsteps, but we have agreed, the councillors and the NHS reps, that going forward we really do need to continue to work very closely together as the organisations responsible for the Health and Social Care Partnership in Argyll and Bute. Hugely challenging time. These bodies have to work to a balanced budget every year, and that's a challenging one for us. Obviously, I'll be coming back to that at the meeting that I'm talking about. We were just looking at the end of the year situation. It has meant committing reserves, and that's you can only do that once, and that's been done. So it is giving us challenges going forward, and we'll be obviously looking at that in more detail. But continuing a theme of that was mentioned earlier about getting out and about, the IJB has decided that its bi-monthly meetings will be out and about across Argyll and Bute. We do have a significant challenge in terms of our geography, and we want the board really to get a better understanding and be listening to what's happening across all of Argyll. So we'll be on the move a bit, and hearing from local groups, as well as trying to get a better understanding of the local issues. One final theme, and again, it's a continuation of a theme. You'll recall that Argyll does have a significant challenge with staffing, not unlike the Sutherland issue that we were hearing earlier. And keeping staffing going is a big one for us. We also, at our meeting, we're doing a bit of forward looking. Gareth led us on some work, and have to say that we were looking at the NHS workforce of over 50 in Argyll. It does paint a challenging picture of where our services are going to be in the longer term. There obviously are many variables at play here, but I suppose as a board, when we do want to be aware of strategic issues, and one of the most strategic issues that we have as a board is our staffing and how we are equipped for the future. So it is one, again, that I'm sure we're going to be returning to, but I think that is one that we'll be doing, I'm sure, much more work, as our executives are already doing much more work with the central government on that. So that's my report, and it's open tomorrow for me for our next IGB.
That's great. Thanks, Graham. I'm really delighted to hear that the IJB is on the road. That's really exciting. And yeah, absolutely, just to recognise what you said about that, working in partnership with the council has been absolutely one of the strengths over the last few years. And I think just in terms of you and Dougie, obviously Dougie steps into the vice chair role now that you take on the chair. So that'll be a good way to ensure the continuity. And I know you guys work really well together. Okay, any questions or comments for the Argyll and Bute IJB? No, okay, thanks, Graham. So we are being asked to confirm that adequate assurance has been provided from our board governance committees and note those meeting summaries, minutes and agreed actions. Is everybody happy with that? Lovely. Okay, thank you, everybody. So that moves us on now to the performance and assurance part of the agenda. So we have item number 4 is our draft annual delivery plan for 2025-26. And I'm going to invite Kristen to speak to this item, please.
Morning, everyone. Thanks, Chair. Yes, so...
oh, you're very, very quiet, Kristen. Sorry.
Oh, am I? Oh, sorry.
Oh, that's a bit better.
Is that better?
Yeah, it's not the best, but we can, if you speak up, we'll probably be okay.
Okay, thanks very much. I'll try my best to hear. So back in March this year, we submitted our annual delivery plan to the Scottish Government, and we're waiting on the final approval from them as the next step in the process. Within your pack this morning, you have the full annual delivery plan and the easy read version of it as well, which helps just give you the kind of pithy highlights on each section. So we got the guidance for the planning guidance came through back in November, and we took the guidance and process through our governance, so our EDG, our FRP and a board development session just to get approval that everybody was happy with that. The annual delivery plan summarises all of our high-level deliverables and our 3-year priorities for NHS Highland, which is set against our strategy, Together We Care. And the deliverables apply to Highland, Pan Highland, Argyll and Bute and Highland HSCP. Within it, you'll see the medium-term priorities for 27 and 28, again from our Together We Care strategy. We have within it as well our key performance indicators and suggested measures of success that we will be aligning into our next iteration of the IPQR after we finish our Q4 IPQR submission. And the performance improvement is a description of what our intended impact on their ADP deliverables will be. So the Strategy and Transformation Programme Managers have worked alongside all of our SROs, our professional leads and senior managers to develop our ADP based on the guidance, and there were additions this year for workforce and risk. We also have incorporated our STAG A, B and C programme deliverables and our value and efficiency programmes and all of our operational priorities have been included. We've touched on a little bit this morning our planned care activity, but all of that work is in there alongside our unscheduled care performance metrics, and all of that is aligning to our financial plan. And Fiona mentioned the operational improvement plan, which this is all incorporated within also. So as I said at the start, we are waiting on the final feedback from the government, and then that will then be put into a final version and given to you for approval later on in hopefully July if the timescales work with that. So it's before you today for noting and approval. I'm happy to take any questions on that. Thank you.
Thanks, Kristen. So obviously we had the opportunity to explore this in some development space as well, which I think was really helpful. But I would really welcome comments and questions from colleagues. Recognise that as Kristen has explained, this is currently in draft format while we await that feedback, but I think it's still a really good opportunity for us to consider this. I think before I go to Alex with his first question, I think what actually we probably forgot to say at the development session, but is really important to note now, is to recognise what a huge piece of work this is, pulling it together. I think you obviously as a a document, as a piece of work, it demonstrates the huge breadth of work taking place across the organisation, which is worth noting. But I think also we can't underestimate how much work has gone into pulling this into something that we see in front of us today. So a big thank you to all the teams that have been working on this. And I think, Kristen, you mentioned all the people that work behind the scenes to pull all this into something. It's no small task. Okay, so I will open up for questions, comments. So I've got Alex first, please.
Thanks. Yeah, morning, Kristen. Yeah, very good document as per usually endorse what Sarah had said about all the work that's going into it. Essentially, I take it there is no actual delay in this work waiting for the Scottish Government's approval, because if it is, some of those KPIs we're not going to make because we haven't started the work on it. Some of them are sort of June 2025. So hopefully the work is actually ongoing and the groundwork's there, and then we can accept the fact that some of the KPIs may have to slip. Is that the intention? If, let's say it's July, we get the approval, and you're going to start moving some of these KPI dates out, or what do you intend to do?
There's a delay in the approval process around how, and obviously with the work that we're doing around our financial planning as well, that's obviously just, we're needing that signed off, but the work is ongoing, there's nothing stopped, and it's just making sure that we are, there was obviously delay with receiving some of the funding for our planned care work, and we're working through how we are going to catch up with that, and obviously liaising back to the access team around any delays that we might have had with our trajectories, but hoping that we actually can catch up with that. But no, everything is kind of on course. We're not expecting any big issues from the government. Our early feedback was actually very positive, and they did like how we laid it out and things. So it's just making sure that we align it properly now to our next version of the IPQR, and that we're on top of that at the moment. It was mainly the kind of funding element that was more delayed.
And just before I bring others on, just to touch on that point you made at the end there, Kristen, about the delay in approval is not an indication that there's a problem. It's just that the process has been held up. I assume that's the case nationally. We're not odd person out at all. It's just that there's a delay in the whole process. Okay.
It's mainly around the financial alignment as well, which we're not worried. It's not that our ADP is aligned with our financial plans. That's all okay.
Yeah, okay. No, that's helpful. Thank you. Okay, I'll take Muriel next, please.
Kirsten, thank you for the report. And just following on from my colleague Alec there, one thing that, while I fully understand the financials and everything associated with that, but one of the most common complaints is I love the terminology in the report. It says make it straightforward to access services. That is one of the most complex things, and one of the most frequent complaints we get is where do people get signposted to, and how do they get on that journey, whether it's carers support or the actual people that are actually needing the service. So I wonder if you could maybe elaborate on that and where we are progressing with that, for that clarity of that start of the journey.
Thanks, Muriel. So improving access is actually one of the key deliverables within the operational improvement plan, and that is obviously something that we are going to have to work on, and that's mainly around our planned care work. Quite a tricky question for me to answer directly, just around how we signpost patients. Patient pathways are kind of, when it comes to secondary care, I suppose, quite clear, and they get taken for lettered for their appointments, but that whole engagement element around it, I might open up to some of my other colleagues to help support that, especially when it comes to the carers. And Catherine's, I see Catherine's put her hand up.
Yeah, thanks. Catherine, do you want to come in?
Yeah, I'm happy to come in. I think, Muriel, if I've read the question correctly, it relates to particularly accessing community services, and And obviously we have our single point of access that has been being developed for the local health and social care partnership areas. So we're promoting access and encouraging people to access service through that route. Clearly there's probably more that needs to be brought, so we can certainly bring that through one of our relevant governance committees. Perhaps the clinical governance committee might be the appropriate place just to bring an update in terms of the work that's going on around that. But certainly there's much work going on across the health and social care partnership to streamline that access, and absolutely recognise the point that you've raised. Thanks, Muriel.
Thanks, Catherine. Okay, I've got Jerry next, please.
Thank you, Sarah. Kirsten, probably a couple of questions, which the number they probably relate to the details of trajectory. So I understand that we may well be still in discussions with Scottish Government as it relates to finance. But I just wanted to understand in relation to, I think this is in the context of, I think our treatment time guarantee, we performed well in this financial year, but the First Minister has obviously given a commitment to 0 waits beyond 52 weeks at March 26. So I would just like to know that that's going to be reflected in our annual delivery plan when we see the final numbers for measuring our trajectories. And I'd like to just understand a little bit of the thinking as well, and what we see our trajectory in relation to delayed discharges being, given that obviously we've ended the 90-day cycle, but obviously delayed discharges continue to be a big issue for us. So I just wondered what our thought process is in terms of where we might be going in relation to that number as well. So thank you.
Thank you. I'll take the one on the planned care work, and then I'll maybe ask one of my colleagues to help with the delayed discharge one specifically. So with regards to the long waits, there's a significant amount of analysis and work that we're doing, because we got last week our confirmed finance for our planned care allocation, and there were a few that we didn't receive funding for, and we're still in discussions with the government around that. All of the bids that we put in for the funding would address the additionality we required to ensure that there was no long waits by March 20, nobody waiting greater than 52 weeks by March 26. However, if we get all of the funding that we require, we then need to go back into discussion and realign those trajectories. And that's basically what the team are working on at the moment, is just making sure that's all in hand, and also having really close dialogue with the access team and the government and sharing that information around what the second tranche of funding might look like, and then how we would then catch up, if we could catch up, and just trying to agree those final trajectories with them. So it's a little bit of a moving feast at the moment, and we're quite hopeful that more funding will come, but with the ones that we have set with them, we are quite confident that we're going to be able to achieve that if everything goes to plan. But you know, we're just in really good dialogue with them at the moment around making sure we can get that additionality in, and there's discussion around the funding, what's core and what's additional, so we're just needing to make sure that we get that absolutely right. I'll maybe ask somebody to come in on the unscheduled care and delayed discharge question, if that's okay.
Fiona popped her hand up, so I'm assuming. Oh no, sorry.
But I just wanted to add to the planned care conversation, okay. If that's okay. I think I might pass the ball on unscheduled care to Catherine, so she's now got 2 minutes to think about it while I make my planned care comment. So part of the reason that the First Minister is meeting with Chief Executives today is in regard of planned care, and there's also a follow-on session with Board Chief Executives talking to each other. So if we take a step back and look at this across Scotland rather than just looking at it from a Highland point of view, it's very likely that we're going to have to work in a different way than we've worked before for every area to achieve that there are no waits over 52 weeks by this time next year. So that's going to require a different mechanism of how we consider the way we utilise the capacity that we've got. for surgical and planned care procedures. But also, Jerry, as you're asking, it actually requires a change in the governance and the way that we've done this before. So because we haven't got that settled within, if I can call it, the usual ADP cycle, then it's not been clarified whether there'll be an addendum to the ADP or we'll have here's a chapter that we're just tacking on the back. All of that will need to be worked out as the chief executives work together to say, how do we do this differently? How do we try and make sure that across Scotland, that as many people as possible who've been waiting a long time for a procedure can access that within the next 12 months. So it is a moving feast, Kristen's right, and we are actively talking to government, but we're also talking to each other. This isn't just something that we need to give to the government and say, fix this for us. We have some agency as boards within this as territorial boards, so it's important we proactively speak to each other. That's happening within regional conversations, but clearly there are some specialisms that even within a regional conversation we may not be able to resolve. It really will take a broader view right across Scotland. So those conversations, as I said, we're having them today. They're very live, but part of that will also be the governance mechanism as well as the actual operational arrangement of how we try and move forward that ambition and make it real.
Thanks, Fiona. And of course, linking, there's a link, isn't there, to the conversations we had at our previous meeting around that collaboration paper and letter from Scottish Government as well. Catherine, Fiona bought you some time there. Are you able to come in and pick up some of the other parts of that question?
Yeah, sure, absolutely. So in terms of delayed discharges, we have recently seen a reduction in delayed discharges. So I think we do need to acknowledge that it's not as steep a reduction as we would like to be delivering. And there's a huge amount of work going on now that is going to take a comprehensive approach, particularly to people that are suffering from the frailty condition across the health and social care partnership area. So we're refreshing our patient pathways within the acute system. We are setting up a frailty unit within Regmore. We're revising our pathways through the emergency department, the acute receiving unit. We've already introduced HPs within the emergency department. We're extending them into the acute receiving unit so that those frail pathways are really well understood. Those pathways are helping us to move people back home again as quickly as possible, to set their discharge criteria so that they can have a shorter length of stay as possible for the moderately to low frail patient. The higher category of frailty will be taken care of through the frailty unit. And then we're also looking at introducing a hospital at home system. We've got 3 areas that we're focusing on in the Inverness area, the Caithness area, and the Skye and Lochailsh area. Those are the areas that have the highest numbers of delayed discharges, and we believe all of those interventions, along with the benefit of additional care home sector capacity opening up in the Inverness area, we believe all of that will help us to reduce our delayed discharges. Thank you.
Thanks, Catherine. That's helpful to hear about those initiatives moving forward. Janice, I'll take you next, please.
Yeah, thanks, Chair, and thanks, Kristen. So as you know, I'm quite new, so it is quite a heavy read, and I can absolutely see the importance of it and being able to measure progress as we go forward. It's ambitious. And so it was just really to echo the kind of huge thanks at pulling all that together. But for me in particular, the easy read section, I think the more we can get of that, better. So I just wanted to really thank you for that. I found that particular part the easiest to read, as you would expect, but just the effort that must have went into condensing that. So I just wanted to give my thanks for that. I'm not a big reader.
Thanks, Janice. And actually, that's a really important point, though, isn't it? Is that the part of what we're doing here is to be able to show publicly what our plan is, and I think there is a lot of detail that is required in the full ADP, as as you would expect. But actually, I think when it is possible for us to be able to summarize that into something more digestible for our public, I think that's really, really important. I think it helps people to understand what our priorities are, but also it's a really helpful reminder of how much we deliver and the breadth of services, and I think that's really valuable as well. Okay, I'm not seeing any other hands up. I mean, I suppose the one part that we haven't mentioned is actually to recognise, this is a really solid annual delivery plan, and I'm pleased to hear that the feedback we've had from Scottish Government so far is positive, although we obviously wait for that final correspondence from them. I think it is probably worth mentioning that this is still ambitious. This is, it's great to hear that we have the confidence that we can deliver on our plan, but I don't think we can underestimate that this will take significant sustained effort from everybody over the course of the year. And just to pick up, I know that this will be reporting back, so it's going to come to EDG quarterly, and it will come to FRP at the 6-month point for that progress update. And as Kristen, as you said, once we've got that final feedback, we can look at our IPQR and make sure that aligns with our ADP. But I suppose it's just to recognise that this is just because we have confidence in the plan doesn't mean it's going to be easy to deliver, and that's going to take a huge amount of effort from everybody all round. Okay, I'm not seeing any other questions or comments, and I'm just going to go back to the correct page that I need to be on here. Sorry, David, bring you in.
Yeah, it's just to confirm what you were saying there, Sarah, that I know Alex and I have conversations from time to time with regard to how to make commitments about under promise and over deliver type of thing, but we would love to have the luxury of being able to do that. But just in terms of what happens with the plan as we submit it, is that it then, although we amalgamate it into one plan, it gets split up in amongst the various functions of Scottish Government, where they pore over it with great scrutiny, and they are pushing each of the elements to the limit as to what they can wring out of the system. So actually the risk can be at an individual constituent level, but actually when you look at the collective, then these are ambitions plans right across the board. And I think just from an oversight leadership point of view, then that is a challenge to the teams to be able to do that. But nonetheless, that's the pressured system we work in. But just to give some assurance, what we're not putting in here is just aspiration without any kind of logic as to how we're making that plan up. So, but we will provide updates as we go through the year.
No, that's helpful. Thank you, David. Okay, so just to remind everybody, what we're being shown here today is the draft annual delivery plan. Just reminding people, this is not the final one, as we are still awaiting that final feedback from Scottish Government. But what we are asking you to do today is to note the content of the report and take substantial assurance that it provides confidence and compliance with the legislation, the policy, and our board objectives, and that the process as we've developed the annual delivery plan and the medium-term plan gives us that assurance. Is everybody quite comfortable with that? Yeah, and as Kristen said, once we get the final, then people will be updated and we can approve that. Okay, thanks, Kristen. That will take us on now to item number 5. So, and as tends to happen, so item number 5 is our finance assurance report for month 12. Item number 6 is our budget update. I'm introducing it like that because sometimes the two bleed into each other. But I will invite Heleth to take us through those items, please.
Thank you, Sarah. Apologies, couldn't unmute. I'll present the month 12 position first. So this is the draft month 12 position. So it's still subject to our external audit scrutiny and sign off. But just a brief reminder that we presented a plan of 50.6 million deficit at the start of the year with an agreed brokerage of 28.4 million. Then at month 7, Scottish Government confirmed an increase to that brokerage of 49.7, which represented the NHS Highland forecast at that time. In month 12, the positions closed at 49.5 million deficit. So we've fully drawn down the brokerage, and that gives us a small surplus of 200,000. This does also give us a cumulative brokerage position of 106.5 million when added to the 56.8 million that we've brought forward. Some key areas to highlight for the month 12 position. We have now received all the allocations. They're all confirmed and complete. For the Highland Health and Social Care Partnership, excluding the adult social care position, there was an improvement in the position for the partnership at the final year end, the last couple of months. The adult social care position, there was a deficit of 16.7 million in total, and that was after a drawdown of around 2.1 million of the transformation funding, and then we received another 5.6 million from the council to reduce that 16.7 million further. The remaining overspend was then offset by an underutilisation and a bit of slippage in the Agenda for Change pay reform non-recurrent funding that we had. Within acute, there's been around 2.5 million improvement in the position since we last reported at month 10 to the board, and this can be seen across all the specialties and the Belford and Caithness. For support services, the central reserves figure that you see there, that's quite high, that represents the brokerage that we've received. And the e-health position deteriorated slightly in month and reporting a 500,000 deficit. And the tertiary position actually improved slightly at the year end, as we didn't receive charges and invoices for some of the activity that we're expecting outside of the area. The Argyll and Bute position, as we agreed at financial planning, Argyll and Bute have delivered a break-even position, and they've done that through utilising some of the reserves to offset the pressures that they were reporting. For our cost reduction plan, we've delivered around 2.7% recurrently, so that was just shy of our 3% target, and we've delivered a total of 30.4 million against the opening target of 51.2 million, with the non-recurrent adjustments as well. For the supplementary staffing, you can see within the graphs there's an extraordinary increase in month 12. But that's mainly due to some costs from prior months that we hadn't reflected and we hadn't picked up on in the position in the partnership. And there's also a provision been included for a potential future claim. We can also see within the total position, not necessarily reflected, but within our balance sheet, we did increase our annual leave accrual by around 3.7 million as well, which is quite significant. For the capital position, our final capital position was agreed with Scottish Government, and we've delivered around 13 million of expenditure across the schemes and areas. So we're proposing a moderate assurance as the board has delivered a balanced position, which is within the agreed brokerage, subject to the audit. But we're not expecting any changes to that position. We're a few weeks into the audit and all's going well at the moment. Happy to take any questions on the position.
Thanks, Helen. Okay, any questions or comments on the month 12 position? Emily.
Thanks, Sarah, and thanks, Helen. Just a question, because Fiona mentioned that obviously there's really good news that HEPMA has been rolled out now, and I know that drugs and prescribing is a big area of overspend. Is that likely to make any difference to the cost control in that area, or is it not really relevant from a financial point of view?
It should do, Emily. That's one of the expectations, is the HEPMA programme did have some benefits through improved governance and reporting and information.
Good, thank you. Okay, I'm not seeing any other hands up. So just to, before you sort of segue into the next bit, we are being asked to examine it and consider the content and take moderate assurance for the draft month 12 position. Are we happy with that? Okay, fantastic. Okay, Heleth, on with the next bit.
Okay, thank you. And this one, like Kristen's papers, is a little bit still a moving feat, and we're still to and fro with some Scottish Government correspondence. So I'm presenting a budget today which doesn't represent the potential final budget, but does allow us the ability to set operational budgets as they stand, with a caveat of potential further adjustments. So the board submitted its finance plan to Scottish Government on the 19th of March, which has not been accepted. We'll take you through the assumptions behind the submitted plan, the expectation and the next steps. So I've shared previously the details of the funding offer that was in the budget, and this has been increased as well with some further funding around national insurance contributions and sustainability funding, which there's some detail of in the appendices. The planning approach expects the board to deliver a minimum 3% recurrent savings, again, as in line with last financial year, with improved trajectories, and confirmed that there would be no access to brokerage for the 25-26 year. NHS Highland plan feedback letter also confirmed an expectation that we don't exceed a deficit of 40 million. And I'll go through the detail of what that means for us. So the plan submission was based on a 3-year financial projections. So it includes our brought forward deficit, includes all of our funding assumptions and our expectations and assumptions around additional costs. Appendix 2 will give you a breakdown of those planning assumptions, but we've been quite frugal with our assumptions, and any additional costs are only things that have been previously committed or our estimates of known events such as inflationary costs and growth in specific areas, generally within prescribing. But we have no new investment proposals that aren't outside of agreed funded allocations. The 25-26 has given us an opening deficit of 115.6 million. We've then applied the same rationale as we applied in 24-25. Which is namely the cost improvement reduction plan of 3%. So we've focused mainly on strengthening the value and efficiency programmes, and we've got detail of some of those targets in Appendix 3, and some annual financial flexibility and balance sheet adjustments that we're just recognising early into the position, and their annual adjustments that we do see year on year out. The adult social care position, we will set a 3% value and efficiency target. But in addition to that, there is a further gap, and we are currently assuming that we need to find action to bring that to a balanced position. And just to note, no budget's yet been assumed for the employer national insurance contribution within adult social care for our directly employed staff, and we are expecting something in that area, but for prudence, we've not included it because we don't know the value. For Argyll and Bute, as with the rest of the NHS Highland services, we have applied a 3% cost efficiency expectation, and after which Argyll and Bute would deliver a balanced position with delivery of that 3%. Obviously, all of these actions that we've stated, as with the performance, come with great caveats and risk of delivery. They're assumptions that we take. We've got scheme behind them, but they do take an enormous effort to deliver. And there's a risk within the position for adult social care and Argyll and Bute in particular, as we haven't identified all of the actions to deliver that balanced position. As this plan hasn't yet been accepted by Scottish Government, there is now some further work that's required to identify other actions that we need to take to achieve the expected position of 40 million. So I've set out some steps being taken to walk through the detail that we need to be able to submit on the 7th of June. And that's been agreed by the executive team to assess any further non-recurrent balance sheet actions and any accelerated areas within the value and efficiency programme and the agreed strategic programmes. The detail of these are going through our executive group meeting, the STAG strategy meeting, and our finance and performance committee prior to submission. I'm therefore requesting that as an interim position, the board does accept the current budget as are submitted to government with limited assurance and agreement for the budget to come back to the next board meeting for further update and hopefully for final agreement. Thank you, and I'm happy to take any questions on that process and caveats. And just to say, we've had a lot of conversation around the planned care funding as well. There's no financial assumptions within the plan for the planned care. That's predominantly because we didn't have any of the information when we were submitting, but there's also an assumption that the funding will just cover the costs. So it should be a net impact anyway. However, within the communication for planned care, it's quite clear that we have to deliver our core activity before we can draw down and access any of the additional. So there is a bit of a financial risk there, but the teams are very aware of this, and Kristen and her teams have got all the detail and are monitoring that actively. So we just need to be mindful of it.
Okay, no, that's helpful. I'm glad you explained that bit. That's really good to understand that. Okay, I will open up now. So questions and comments about the budget as Heleth has just presented, or around the process. I've got one to start us off, and I'll bring colleagues in after that. And apologies, this may have been discussed at FRP. I haven't been able to attend the last couple of FRPs, so apologies if this has already been aired. I'm just keen to understand the figure in the letter from the Scottish Government around the 40 million. Appreciate, Heleth, that you and your teams are in regular dialogue with Scottish Government and will have maybe a deeper understanding. I'm curious as to what that number is based on. And I suppose what I mean by that is that on reading that without the background information, I think there's a temptation to believe that that's based on, that they've looked at our activity or our work or what it is that we do and believe that we can hit that figure. But I'm interested to understand if that's the case, or how that figure of 40 million has come about, and what the discussions around that particular figure have been.
Thank you, Sarah. There was no previous discussion. There was no dialogue. It was a cold letter we received with the figure in. The verbal explanation that we've had is that we received additional sustainability allocation, and they've taken the value of that sustainability allocation and taken it off our plan. Now, that sustainability allocation was already in our plan, but I think they've looked at our prior year outturn, our opening position, and they've set their expectation of where we are. So they've not had the access to all of our detailed around our increased cost expectations, and don't have the detail to that planning assumption that we have. But I think they've just looked at our spend trajectory, our position over the year, and they've positioned an expectation that they hope that we would get to. So I'm not sure that there is a scientific calculation behind it, or if there is, it hasn't been shared.
Okay, thank you. No, that's helpful. Alistair, I'll bring you in, please.
Yeah, thank you, Sarah, and thank you, Heleth, for the introduction. I think each year we say it's getting more challenging, and this one is extremely challenging, especially with the cap at 40 million deficit, and then to get over that. One of the areas that I don't think is articulated in the report, I noticed there's an appendix which shows the value and efficiency 3% savings of 20.3 million. But we said on the previous item, and we say on this item, about gap in adult social care funding, yet we're looking to, if I've read it right on page 251, we're looking to have a 3% saving in adult social care, which is 6 million, and then delivering adult social care to break even, which is a further 19 million. So taking best part of 26 million out of adult social care, and we're still got the difference between the 40 million cap and the 55 million gap as it's shown here. But I can't recall seeing any proposals as to what sort of big ticket items would make up this 26 million reduction in adult social care. And it'd be useful to try and understand, what they are. I'm also conscious, Sarah, that this is going to be submitted by the 7th of June. So, a full grouping of non-execs will not be able to see the final version that goes in. I don't know if it could be circulated to us so we could so we could at least see it for awareness and any thoughts we might want to put into it. But I suppose my concern is that trying to deliver this request to get down to 40 million deficit, and one of the big ticket items being adult social care, where we don't actually have a very good track record over quite a number of years of delivering savings, and it's only ever been done through amounts from reserves or whatever to do it. I just fear that we're on a back foot to begin with, but I'd be quite interested to hear what the big ticket items are that could actually deliver it. Thank you.
Thanks, Alistair. Okay, Heleth, would you like to come back in on that one?
I'll start it. I'm not sure that I can answer all of it, but just to say, to start with, Alistair, so the position around adult social care is unchanged. So that part of the budget paper is unchanged from the information that's been presented to full board within committee meetings, development sessions, and FRP previously. So those assumptions are in line with the information we put in last year, and there was a not dissimilar gap last financial year as well. The principle behind that is we can't show it as a health deficit at the start of the year. We do need to find a partnership solution to it, and recognising that we're trying to use the transformation funding as we have it from the council to try and pump prime some of those schemes and areas that might deliver change for us. So there are some programmes, and quite big, significant programmes, that have been submitted. What we don't yet have necessarily is the detail of the improvement trajectories, because we need to do that work and pilot them to really understand how much of an impact they'll have. So the in-year position, absolutely agree, will be very tricky, and we need to work through that as the year goes ahead, as we did for the last financial year. The 16 million further reduction will obviously be within health, and that's the bit that we're evaluating to see where those opportunities are. Well, the first thing we've looked at actually is our 24-25 closing position and how that has changed against the plan that we submitted. So as I reported in the month 12 position, we've had a 2.5 million improvement within acute. So we've reflected that back through the plan. And there's been some improvements within the partnership as well. The reduction in partnerships tended to be non-recurrent impacts of things that we've played in. So we think that our opening plan position will be reduced anyway, and then there'll be some further actions that we'll look at, and we can absolutely circulate those wider before it's submitted, but it will all be very tight. It's going to the FRP on the Friday and needs to be submitted on the Friday. So the timescales are quite tight for turnaround and delivery. But the adult social care position is always a challenge, but I personally don't think that we can show it as anything other than a balanced position for opening assumptions.
Thanks, Heleth. So I think that the point there as well, just to pick up, you said that was going to go through FRP, and I suppose just to remind members, even if you're not a member of FRP, you can obviously attend, and that's probably quite a helpful thing to do. I appreciate not everybody will have availability in their diary, but if people want to attend FRP, sorry, Alex, I'm opening up the invitation to your committee, but if people want to attend FRP, I think that might be a really helpful thing to do. But I can see, Alex, were you coming in and sort of off the back of Heleth or something else? I'll bring Jerry in first then.
Thank you, Sarah. I don't know if this is a question or an observation for Helen. Looking at Alan Gray's letter, Helen, at the end of the paper, and to me it's quite significant that the opening paragraph talks about a deterioration in our financial position, from their perspective, a deterioration in our financial position from A to B, which I think probably drives their 40 million and however they got to that figure. And I think this goes back to almost 12 months ago when there were Scottish Government figures getting produced in terms of the size of our deficit, which disagreed, I think, from your understanding of the deficit. I think there was a number of 59 million, I think was, if memory serves correctly, which we always maintained was our position. So I suppose my question would be, in your ongoing discussions, have we been able to get to a point where we've got a shared understanding with Scottish Government as to exactly now what our recurring or underlying position is, so as we avoid potentially this moving forward, them actually doing A minus B equals C, and we say, well, that's absolutely fine, but A is not the starting position, if you know what I mean.
Part of it is, I think, for the 24-25 plan, Jerry, we submitted a plan that was 50.6 million, but then we said to deliver the brokerage cap as you set it out, we would have to take these other actions to bring us to that plan. So they always took our 28.4 million as being our plan position, and we've said all through the year, no, it wasn't, it was 50.6. So our entire reporting year, we've been debating and questioning that. However, technically, and I've just scribbled this down, so don't hold me to the absolute figures, but roughly, I think that in 23-24, our opening deficit was around 105 maybe. 24-25, we opened at 112 million, and then this financially, we're opening at 116 million. That's our opening, and then our final position, 23-24, was around 16 million. 24-25, the one that we just seen is 49.7 from a brokerage perspective, and then we're looking at 56 million. So technically they are increasing and deteriorating slightly, but the 24-25 one in particular is when we had zero uplift. So really you would have expected that deterioration, and I think other boards had that deteriorated jump quite significantly in that financial year. So I'd say personally in 24-25 we actually stabilised quite well, given the fact that there was zero uplift. That's quite a significant amount. We've had 3% uplift for the 25-26 plan. I can understand what they're saying around the 25-26, not just having that uplift, but we've also had some additional sustainability funding. But we've also got significant cost pressures that are ongoing. We know we've had national contribution to some national schemes and things that were agreed 2 years ago, and we're just seeing the impact of those now. So there's things like that coming through that the government won't necessarily recognise and acknowledge within their planning. So technically they are right that our position is deteriorating, but it's not deteriorating at the rate that it could be doing. You know, we're talking a few million, and the closing position, which is the bit they look at, is that 16, 49.7, 56. That's been heavily supported with non-recurrent actions. And that first 23-24 year, that was a year coming out of COVID, where we had quite significant amount of reserves, and we had some money lodged with government from the health perspective. We had some reserves sat with the council from the adult social care perspective. And you know, we've utilised most of that throughout 23-24, some of it towards 24-25. It's all gone by 25-26. So that bottom line figure is going to deteriorate just because of the non-recurrent money that isn't available anymore. But the opening gap, I would say, has stayed relatively consistent around the 110k mark, there or thereabouts. That opening plan figure will come down a little bit now that we've done that revision to the plan. So we've looked at our pressures that we assumed within the position for 25-26. We've assessed them against our closing position for 24-25, and they have come down slightly. So that opening balance isn't deteriorating, I think, when we resubmit. Hope that answers, Jerry.
No, it absolutely does, Helen. It absolutely does. And I think part of this is about perception and understanding to the level of detail that you and Elaine obviously have. You can't expect Scottish Government to understand however many boards there are now to that level of detail. And I would share your position that 24-25 is, that to me, is actually really quite a stable position for moving forward from. Thank you.
Thanks. I think, yeah, and actually the way that you've explained that there, Heleth, I think for those of us who don't have a financial background, it would be difficult for us to extrapolate that, you know, what you just explained, kind of how that plays out. And actually, I think that's been really, really helpful for those of us non-finance headed people to understand that, you know, the figures are what they are, but there's lots behind it that will determine your assessment of what those figures mean. Okay, I've got Alex next, please.
Thanks. And yeah, the open invite to the FRP meeting on the 6th, I have no problem with that at all. Heather, on the additional costs, I understand that you quite rightly have put the full impact of the national insurance increases in. I'm assuming, is that under national and policy decisions or other pay pressures? And then to add to that, the adult social care position, are you assuming the same? Are you assuming that the national insurance increases will be fully met, or are you assuming it's only going to be 60% and therefore there's an additional problem potentially coming through from the council side if they can't find that money?
So currently within the health position, we had included the employees' national insurance for directly employed staff within our pressures, and for the adult social care the same. We have received funding for an element of the national insurance, the 60% from government for health. We've received that, so that we've got the corresponding income within there within our planning assumptions. And then the expectation within some of our sustainability funding was that that would offset any current pressures that we have. So effectively, the remainder of that pressure is taken a call on that additional sustainability funding. For adult social care, we have assumed the cost of national insurance impact of directly employed staff, and it's around 1.3 million, I think. We haven't assumed any funding from the council at the moment, and we know that they've set aside some funding. It was in their budget paper to provide some funding for adult social care national insurance contribution, but we don't know at what level yet. We assume that it'll probably be around 60% for directly employed staff, so it does still leave that 40% gap, but it's the entirety of that gap is in our position at the moment. So that current gap for adult social care can only come down from the national insurance contribution. The bit that we've not included is any external contractors, either in health or social care, because we've no assumed funding against it either. So if we do get a contribution towards independent sector national insurance within adult social care, then we'll pass that forward, but it'll be a net zero impact within the finances that we're reporting.
Thanks, Helen. And Steve, please.
Thanks, Chair. Yeah, I should have said on the previous paper, the variance of 200k at year end, I think is, I want to just compliment you on that in terms of how accurate your projections were. So with a massive budget like this, I don't think I've got a question, but I know that we've got a wee bit of time, Chair. So it's just to start the conversation when the Chair asked the question about where the 40 million figure came from. And just sort of reading that letter, that was my question originally, and it was interesting to then hear, the conversation move forward in terms of your understanding, Health, of how the Scottish Government might have come to that figure. And I guess what interests me is our approach as a board with the Scottish Government, because I see at the end of the letter, I appreciate it's a ministerial letter, it offers a call. I think that's probably ministerial speak for staff to staff engagement. I don't know. But, is there any merit in us going back as a board to just query where that came from and perhaps, go in and try to defend the position from an NHS Highland board perspective? Or do we see no merit in that? I just think in my mind, we're slightly passive. We have the ministerial letter, we've got the 40k, we're going to do the work. There doesn't seem to be much guidance in terms of where the government would like us to go as a board. It's just get on with it, and then we'll have a look at the risk that you come up with. So my question is, do we go back, or do we just move forward in a more passive way to try to find that 40 million, not really understanding where it came from?
Thanks, Steve. I've been having weekly meetings with the Scottish Government finance team, so there has been dialogue and communication since that letter, and I will be honest and say the first meeting was quite challenging, and I did give quite a lot of challenge back because I was quite frustrated to have seen that land cold, because we didn't get a heads up that it was coming. So that first meeting we had was very challenging. There was very little give back. However, I will say the letter's written quite starkly, and it's quite clear that you must deliver this, and there is, you know, there's no leeway around it, and you must provide the options. But in dialogue, what we're hearing is more of a, we want to know what your options are that would deliver that position for you. There will then be a dialogue and communication around, do we think that's acceptable? What we've agreed as an executive team was, you know, we wouldn't be putting forward options that we didn't think were palatable options that we didn't support and impacted on our ADP and what we've been putting within that. So if we don't get to the 40, then it will be with a caveat of this is what we think we can do by accelerating our current plans and processes and systems. And Scottish Government, and this is all finance team, so when I say Scottish Government, it's all the finance team that I've been in communication with. They were actually quite comfortable that there's a bit of flexibility on the 40 if we can evidence that we've got a trajectory for change. And some of this, the paper we've got further on in the meeting around the strategy, you know, some of this is very difficult to articulate, because until we've got a clear strategy going forward as well, then that really longer term future and trajectory is harder to calculate. But what we need to do at the moment is to give some assurance around delivery of our current strategic plan, and just to show that that's going to move us in a direction. And then we've got a plan to do something different, and that doing something different will come with its own risk. But I think just carrying on doing what we're doing now isn't going to deliver the change that we're going to need to deliver to bring us into absolute financial sustainability and balance. So Scottish Government recognise that. They know that we need to do something different, and they're relatively comfortable with that. What they don't want us to do, obviously, is deteriorate in that in the interim, and that we can at least show some steady progress. So they want to see our journey, they want to see our plans and how we're behind this as an executive team. They're not just focused. I know it feels as if it was very focused on the in year 25-26 position, but actually what they want to see is that trajectory and a commitment towards improvement. So that didn't quite answer your question, did it, Steve? So are we being passive? I don't think we are. I think there's a element of, we do need to challenge our plan and push it harder and further if we can. So if there is a bit of flexibility within there, then we do need to draw that out. The challenge for us, I think, will be our 3% savings in the adult social care position. That will be a challenge. We've not quite delivered on 3% for 24-25, and it was tough. Efficiency savings are getting harder the more you try and do efficiencies, because there's only so much you can do without changing systems. But I think it's the right thing to do to try and to see what we can set out to. So we've not committed to achieving 40 yet. What we've committed to do is see what it would take to get there. And we're not going to propose anything at this point that means a change to our ADP. I'm going to pause there and I'll let you come in if I've not quite answered, Steve.
I'm going to come in as well. Thanks, Heleth. I think you've explained that really well. I think it's a really good point, Steve. I think, and I think maybe it illustrates one of the challenges around how the system works. And I suppose David touched on it a little bit earlier when we were talking about the ADP, about, you know, we're trying to pull everything into one plan, and then it goes into Scottish Government and it gets chunked up into different bits, and they give us feedback on different bits, and then we pull it back together again. And I think the letter is almost a part of that system. And I think whilst I suppose, as Heleth has described, getting the letter and the figures that were in that letter, I suppose reading it cold can feel a bit, well, I suppose confusing is one word for it, you know, not understanding the logic behind it. But I suppose it's then when we take a step back and see that individual letter as a part of a bigger picture and a wider dialogue that we have with Scottish Government. I think I've certainly, and granted, not all of this will be visible in the same way, but I suppose Fiona and Heleth keep myself and you know, Alex up to date in terms of the conversations that happen behind the scenes and how those conversations evolve and develop. And I think that's really helpful. And then we see that come to fruition publicly as the plans mature and go through the governance process. I think also, just to pick up 2 points that Heleth made, which I think are absolutely crucial as we move forward through this. I think the plans that we are putting forward, there is confidence that they can be delivered. I think that is hugely important for us as an NHS organisation. I think David talked about it as well. Yes, hugely challenging, but we have to know that those plans have got credibility and that we believe that they can be delivered, although it will be really challenging. And I think the second point that Heleth made, which is really important, is that we could have responded to that request from Scottish Government by putting things on a plan that we wouldn't necessarily be comfortable with. And I think the fact that, as Heleth has described, there's nothing going into that plan that is not in line with what we want to deliver in our ADP. We haven't veered off that, and I think that's really important. But just to bring it back to that point, we do, and obviously this comes up later in the agenda around our strategy. I think it's a fair point about not being entirely passive, but I think we also recognise that we can't just continue to swallow more and more money indefinitely without reconsidering what we do from a sustainability perspective, and also in terms of what's right for our communities. I think if we don't, picking up the point later in the agenda, if we don't pick up the point around our strategy and our direction of travel going forward, we would just grow exponentially and there would be no end to it. So I think all of those things play in together, which hopefully that's made sense. But Steve, you wanted to come back in, so I'll bring you back in.
No, thank you. And that's all been really helpful for me to understand, that staff to staff, work that's happening between Scottish Government and Heleth's team, and it does sound really constructive. I guess my last point of promise on this is, I noticed the letters addressed to Fiona, and it, as accountable officer, addresses the board, and just in terms of audit, we don't respond to that. Then we don't send a formal response back. There are items in that letter that I think do need at least some clarification. Trying to understand, where's the analysis behind the 40 million? What, just some. I think just for so if it's okay that we don't respond to the ministerial letter formally, that's fine, and we just operate staff to staff. It does seem to leave something open to me that we have the ministerial correspondence, but we don't respond. And if that's not the expectation, I think that's okay. But just to clarify that for me, that from an audit perspective, we've got the letter and that's it. And that doesn't seem to provide that sort of closure from a board perspective. It's a genuine question.
No, it's a really good question. And I think actually, again, similar to the ADP, these are quite sort of protracted processes, but I don't know, I've got Fiona and Heleth both wanting to come in to explain how we close that off, but it's a good question, Steve. Fiona?
Yeah, I think it's a fair challenge, Steve, and I think obviously we've got a date where we need to make the financial submission, and Heleth and the team are working, as you've heard, on that. I'm always happy to take an opportunity to write back to the Minister with my thoughts about the running of health and social care. They obviously get to the top of the pile without question, but I do think as accountable officer it is important to say that we're balancing our responsibilities here across our domains of governance, if we want to look at it in that way. So what I want to do as accountable officer is ensure that we maintain the level of service that we can within the resources that are available to us for the people of the Highlands and Argyll and Bute, and not act to the detriment of our population, but balancing that with our responsibilities as a public body to be in line and in balance with what's expected financially. So it is a tricky balance to get that right. So, and also I think we have to be really realistic about the pace of change, not just in terms of our staff and our well-being and our workforce, although that's really important, but change also has to be mediated through the public, through our planning for people guidance. And also we have to ensure, I think, and when we run health and care services, that when we change, we do that with great care, because sometimes there can be unintended consequences to change that can impact on risk or safety. So we have to move very gracefully when we change within health and care systems. So when we are looking to bring ourselves to back to a point of balance, we need to do that with some grace. So for me, I suppose the broader point is, by asking the question about the number, which probably to a degree has a level of arbitrariness to it, I'm sure if you put through a percentage calculation, it doesn't come out with a round number generally. So I'm thinking the fact we got a round number is probably an indication that there was a level of rounding, and we can debate the level of rounding. But we do need to make progress on working on our sustainability. And as Sarah said, there's a broader ethical point about the balance of health and social care spend across the whole public sector. So I'm happy to top and tail our plan with a formal letter, and reflect some of the conversation we've had in today's board meeting, which I think has been a rich one, and the conversations that we've had within our executive space and FRP, to kind of share our thoughts and journey with the Cabinet Secretary.
Thanks, Fiona. And before I bring Heleth in, I wonder if I might propose, in doing that, I think that's a really good idea. We can sort of top and tail it as you've described. And I wonder if there's something about how we frame our questions slightly differently as well. So I think reflecting some of the conversations we've had here can be done in a constructive way. I suppose also, once Heleth and team have the final submission to go in, and that'll get looked at FRP, I suppose it's understanding, and sorry, I'm thinking on my feet, so I'm struggling to think of the exact right words, but the essence of it is that as a board, we need to understand what happens if we don't hit the 40 million, because I guess that hasn't been explained fully. So it can, and we can frame it much better than that. We can have a think about the wording so that it's done in the right way. But I suppose the question is less, how did you pick that number, and more, here is our updated plan. This is what we think we can deliver. We're confident and we're comfortable with this plan as a delivery plan. And we need to understand what's next for us as a board in terms of that wider dialogue. But this might be something we have to take offline and consider exactly how we do it, because I think Fiona's right. It's a balancing act, and we need to balance all of these different elements. But Heleth, I'll bring you in with any final thoughts.
Yeah, thank you. Similar points to those that Fiona's just made, but just to say, Steve, I did have the conversation with Scottish Government, because when the paper did land, I think Fiona was on leave, so I did ask, do you want a formal response back when Fiona returns? And they said, no, we don't need it, because we've engaged with you. You've responded by getting in contact effectively and by having the weekly meetings. But my proposal was going to be that we had that formal letter that went alongside the plan submission, so we're tying it all together in our response there. And I think we do need to, in that response, set out our financial context and landscape. So highlighting our kind of population statistics, our distance from NRAC for years, our deprivation, working age, all those things, all those factors that we've got the statistics around that show where we sit within the Scottish context. So we can set all of that out. And what we're not saying at the moment, and so we've really worked through the figures, we've not actually said we are doing everything we can to submit a plan that will say 40. We'll submit a plan that we think is deliverable within the context that we're working within, and to continue to deliver our ADP. I suspect if that doesn't come down to 40, then we're in further conversation perspective. I did ask what the impact would be of not delivering 40, but more in the context of what incentive do we have to move from 56 down to 40? So not necessarily what if we hit 42 rather than 40. And the response back was we'd be reviewing the escalation framework, which is a fair response.
Okay, so shall we, oh, sorry, Alex, on you go.
Yeah, just very quickly. Last year at this time, when we were doing the budget, we had the list of unpalatables. These were the things that we would do if you forced us to get to this date. I'm glad to see you doing that, because that was a risk that worried me, that they've said, well, yeah, okay, we'll take the political hit, on you go. I think we need to emphasise the fact that, as far as I can see, we're not affecting services here. So therefore, our commitment and contract with the public remains as is, rather than the financial pressure. So hopefully that's something that we can continue with. Thanks.
Thanks, Alex. Helen.
Thank you, Alec. I guess just to be clear, we're not necessarily saying that no services will be completely unaffected, because we are going through a strategic change programme and we've got value and efficiency. So there might be tweaks to that and changes, but they will be set out within our current trajectory of work plan. So we're not saying we're just going to stop this service. This has come out of the blue and, you know, we've been paying for it non-recurrently, so we can just end it and that would be easy. With that, they're the bits that we're not doing. We're looking at our current work streams to see, is there anything that we can bring forward or wrap more focus around to deliver it in a different way? They're the things we're saying. We're not presenting the choices as they were last year, partly because they weren't accepted last year. So if they weren't accepted last year with the improvement plans and such like, I can't see them being accepted again, because they would have impacted planned care activity in particular. And I think that will be our conversation. If we don't have a plan to deliver the 40, that will be our conversation of, well, these are the things that we'd have to present back to you again, and we don't really want to go there. So not saying that question won't come back again from Scottish Government, but that's not the place that we've gone to start with.
Thanks, Celeste. And Gareth, please.
Yeah, and probably just to emphasise that one of the challenges around the unpalatables list is, in some respects, that is indicative of a need to engage with our communities to understand what choices we have going forwards, and would not have been feasible within the guidance around planning with people. So that's one of the sort of issues we need to think about as a board as we go forwards, because there will be difficult decisions for us to make potentially with our communities and planning with people. So I suppose that's the challenge that partly our board strategy also needs to look at, is what does the future shape of our health and social care services need to look like, and how do we then engage around some of those maybe difficult decisions we need to make to achieve that future shape.
Okay, thanks, Gareth. I think that's a really good point. I'm trying to pull all conversation that we've just had into something. So we've got an opportunity, because we've got FRP on the 6th, that's right, isn't it? Yeah. Are we happy then just to pick up the points that Steve made and Fiona's response about thinking about how we top and tail this? Are we happy then that as a board we delegate that to FRP, so that can be taken offline? We can consider how we top and tail that response that will go back to Scottish Government with our plan on the 7th, and we can use FRP as a forum to look at that. Are people quite content with that? Okay, great. Good. And as I said before, if people are able to attend FRP on the 6th, it sounds like that would be a really worthwhile thing to do. I won't be able to, unfortunately, because I'll be driving to Inverness, although I might be able to listen in on my phone. But I think that would be a good opportunity for people to engage in that conversation. Okay, I'm not, just to check before we round this item off, we don't have any other questions or comments around the budget update. I think that was a really robust conversation, so I think we've probably aired everything we need to at this stage. And just to remind people, so we're being asked to examine and consider the content of the report, and given where we are in the process and everything we've just discussed, we're proposing that we take limited assurance at this time, which I think is appropriate. Is everyone happy to do that? Okay, just a note on timing. So we're gonna stop for a break in a second. I've just been looking at some of the timings that we have for the rest of the agenda, and I think we were being a little bit over generous. So what I'm going to propose that we do is we take a 15-minute break now. I don't think we will need to take a lunch break later on in between business. I think we'll get everything done much quicker than the agenda currently suggests that we will. I'll keep it under review. If it feels like it's going on and on, then we'll obviously take another break. But my proposal is we'll take 15 minutes now, and then I think we'll get the rest done in a pretty good time, and then obviously finish for lunch, if everyone's okay with that. So I will see you back here. Let's have 16 minutes. See you back here at 11:45 for a nice solid quarter of an hour. Thanks.